There was just a publication this year that looked at Southeast Asian countries, 11 countries, and it showed that the young group is actually increasing in terms of breast cancer incidence. So I think we have to be really aware about this.
How is it different in terms of managing those patients who are in their reproductive age group and also when they are pregnant? How is it different compared to our typical patients who are already menopause or maybe they are more than 50 years old?
Okay, I think the first thing is that we have to recognize that the commonest age groups that get breast cancer is women in their 40s, 50s and 60s. So only about 2% of people in Malaysia who have breast cancer are less than 30 years old, 35 years old. But 40 years old, it comes up to about 28%. And the rest, 70% of them will be in above 40 years old. So the young group is actually not that many, but the numbers are increasing. There was just a publication this year that looked at Southeast Asian countries, 11 countries, and it showed that the young group is actually increasing in terms of breast cancer incidence. So I think we have to be really aware about this. And you mentioned a few of the challenges because our country is a developing country, a developing nation. So there are a lot of socioeconomic transformation, and therefore you can see that people are having their children later, right? And then people are having their periods earlier. So the risk factors for breast cancer is increasing in our as we speak. And this group of women will definitely have more risk of having pregnancies during breast cancer. So in terms of the management, I think when we talk about management, you look at the person as a whole person. It is not just the individual, but also the people around them. It could be their spouse, could be their even parents, because these are young women. So I think the difference, management-wise, not much difference, because we believe in age doesn't really change the management, the clinical management of the patient, but more so the biology of the tumour. So a lot of the treatments are based on what type of breast cancer the patient has. Okay, but in terms of handling a patient would mean that you need to also consider other issues, the values of the patient, especially if the decision maker is not her. It could be the parents, for example, or even the husbands. So when we counsel this type of patients, it's very important that we, as doctors, we recognize that they have other people that might be making the decisions. So when we talk to them, we have to make sure that they are present as well. Okay, so the treatment is actually quite the same with older age groups.